Hi everyone, this is Michelle Shields, the Staff Development Coordinator for the Holgate campus. Today I'm going to talk to you about oral health care. This is a three-part series with a quiz after you've completed all 3 training sessions, including the videos. You will be able to find all this, of course, on the Holgate Community Education YouTube channel. If you'll look in the playlist, under oral care, that's where you'll find the videos, and you should find this video just under our regular videos. We'll see. So this is, like I said, a 3-part series. Oklahoma Nursing Home Oral Care Project in collaboration with TMF Health Quality Institute put this together. So let's get going by doing a little pre-assessment and see where you feel like you are with your knowledge of oral care. So there is a direct relationship between the lack of oral care and pneumonia. How many more times is a resident likely to die from pneumonia with poor oral care? It would be 3 times, which is pretty darn scary to me. That's why oral care plays a huge part in our patients' health. Question, what is plaque made of? Give you a second to think about that one. And it would be bacteria. Everything we eat and we drink, even medications that we take, all that can lead to bacteria. Question number 3. A dirty mouth can contribute to which systemic disease? And that would be all of the above. Question 4, what causes tooth decay and gum disease? That would be plaque. And our last pre-assessment training question is, what is the most effective way to prevent cavities, gum disease, and tooth loss? And that would obviously be brushing and flossing, which we learned at a very early age when we first went to the dentist. Okay, let's get going. Why daily oral care for the elderly? So what you're going to learn today are some links between daily oral hygiene, dental-related diseases and overall health, cause of tooth decay and gum disease, and how to prevent tooth decay and gum disease, and what to look for during a daily oral assessment. So plaque is a substance filled with germs, bacteria. It forms every day on our teeth. Plaque is constantly forming on our teeth. It's important that this soft plaque is removed twice daily to prevent oral infections and contribute to systemic health conditions such as heart disease, pneumonia, stroke, diabetes. Remember, dirty mouths like this can make our residents very sick. So twice a day, if for some reason that the resident will only allow you to do it once a day, which you may have that challenge with maybe a dementia patient, but for the most part, everybody is going to want their teeth brushed twice a day. It just makes you feel better. Your face washed and your teeth brushed. But if you can only do it once a day, and if you're only doing it once a day, make sure you're letting the nurse know that they're only allowing it once a day. It's best to do it in the evening. So their teeth are nice and fresh, and you've really cut down on all that bacteria and germs and plaque so that it doesn't build as the mouth is closed up for the night, so to speak. This is a picture of plaque and tartar on your teeth. Pretty disgusting. Here we see an infected mouth as a result of all the plaque and calcified plaque. That stuff's really hard to get off. You have to scrape it off. That has not been removed. This mouth definitely needs to have attention immediately. You can see how red the gums are getting as well. This is what happens when plaque is not removed daily by brushing and flossing. The plaque just hardens up and it becomes tartar. Once a soft plaque hardens and calcifies, it no longer can be removed with brushing. A dental professional will need to remove the tartar. You can see how red and swollen the gum margins are. This tartar that forms under the gum line is similar to having a splinter left under the skin. The skin will become irritated, red and swollen, sore, and if not, or if left long enough, will excrete pus. Our gums respond in the same way to tartar, and these harmful toxins have direct access to our bloodstream, contributing to systemic health burdens such as pneumonia, heart disease, strokes, diabetes. A resident can also get sepsis from teeth like this, which we know can kill our residents pretty quickly. You'll see similar wound surface area. You'll see this picture of the hand and how it's the same if you have this on your hand, or vice versa. These teeth is the same as having this hand, and this hand is the same as having this teeth. On the right, the mouse shows periodontal disease. There is obviously infection present. You can see that. This is a wound in the mouth. The surface area mouth wound is about the same surface area of the palm of your hand. So you look at the picture at the left. If you saw this wound, you would treat the area first by debriding it and with medication. And the same needs to be done for the mouth wound you see on the right. Bacteria goes directly into your bloodstream and causes harm. In the color diagram on the right, we see all the plaque highlighted in green. All these germs are also under the gum line between the tooth and gum, as you see in the picture to the left. These bacteria have direct access to the little blood vessels within the gums, which then goes into the bloodstream throughout the body. These bacteria are harmful and toxic, contributing to system chronic health conditions such as heart disease, stroke, diabetes, pneumonia, and I'll add sepsis to that as well. And obviously, plaque causes tooth decay. These teeth are really decayed. When plaque is not effectively removed daily, it mixes with sugars and carbohydrates and that we eat in our diet, which form an acid. So each time you eat food that contains sugar or starches, bacteria in the mouth breaks this sugar and starch down and it produces breaks it down to produce an acid, and this acid attacks the soft enamel for about 5 to 15 minutes each time you eat. This is another reason why it's important to brush the teeth. Plaque also causes gum disease. Gum disease is a preventable disease by good oral hygiene. It's not a disease that has to occur with age. However, if the plaque is not effectively removed daily and with good brushing and flossing techniques, the germs in the plaque can and will destroy the gums and the underlying bone structure. From this picture, do you see how the gums are receding away, making the teeth look longer? Now imagine the underlying bone. Not only are the gums receding away, red, inflamed, and bleeding with possible excreted pus, but there's also bone loss. This means this person's not going to be able to eat really well. It compromises their nutrition, makes it very difficult to heal wounds, and sometimes drink fluid. They can get really sick. Brushing and cleaning between the teeth. This prevents gum disease, cavities, and tooth loss. In 2008, Florida Nursing did a home study. Nursing home residents who had daily oral mouth care provided by nursing assistants whose only job was to provide oral care had 3 times less risk of dying from pneumonia. Now, in the perfect world, that'd be great if we had a CNA who just gave oral care to all our residents. That would be amazing. Unfortunately, that's not realistic. The Florida study is important because it showed that pneumonia is the #1 cause of death in nursing homes. And poor oral hygiene contributes to aspiration pneumonia. And we have quite a few patients that come in from the hospital into Friendship that have aspiration pneumonia. Breathing in germs from dirty mouth is a significant risk factor for pneumonia. Gum disease may increase risk of heart disease and stroke. We talked about that. These toxins create inflammation in your body, which studies show weaken our immune system. People with serious gum disease were 40% more likely to have a chronic condition on top of it. And let's talking about the immune system a little bit. Where is 80% of our immune system located? That would be our digestive system, and our digestive system starts with our teeth. Risk of death. Residents with diabetes and severe gum disease are more likely to die from complications. 11-year study of 628 people found that those with severe gum disease had 3 times the risk of death from heart disease and or kidney disease. Wow. Residents with diabetes and gum disease have more trouble controlling their blood sugars. So this mouth right here can affect how your glucose readings come out. A dirty mouth can make our residents sick. It's also like not, they don't want to be around people if they're having, a filthy mouth or a dirty mouth, or their mouth smells or their breath smells. It may prevent them from going to activities and socializing. Healthy mouth, helps people eat the proper foods and prevents pain. Xylitol for dry mouth. It's a sugar alcohol from plants. It's all natural, fiber from fruits and vegetables, reduces cavities, and it's great for dry mouth. There's also a couple other different things that are used. How this works, it behaves very differently and is actually able to change the chemistry in the mouth to reduce incidence of cavities. Xylitol has a different carbon chain than sugars, including sugar substitutes. When Plaque eats 100% xylitol, it is not able to digest or metabolize it like sugars. Therefore, without metabolizing it, there isn't anything sticky buildup that blocks, sticky building blocks for the acid to form, and as a result, it reduces the incidence of cavities. Strive for 5. Strive for 5 exposures to xylitol daily to reduce decay. Breakfast, mid-morning snack, lunch, mid-afternoon snack, and dinner. So some people who are at a very high risk for cavities, they'll be put on special toothpaste that will have this xylitol in it. So xylitol you can get at the grocery store, health food stores. Sometimes it's in mints and gums, toothpaste, mouthwash, lozenges, and gels. Excuse me. You should do a daily oral health assessment. It shouldn't take more than 60 seconds. You need to report any pain, lumps or swelling or sores, dry corners of the mouth, dry mouth, broken or decayed teeth, broken or lost dentures or partials. Notify your charge nurse or your floor nurse or the RCM, RCC on your floor of any of these. Oral cancer in the elderly, 7 times more likely to be diagnosed with oral cancer than those under age 65. So when in doubt, refer it out. Herpes of the lip begins as a blister, then blisters scab over. It is contagious. Healing occurs in about 7 to 14 days. These are commonly known as cold sores. When in the blister form, that's when it's the most highly contagious via contact. Angular Chelitis. I have never seen this before. It's from ill-fitting dentures, yeast infection, thrush, vitamin D deficiency or vitamin deficiency, and dry mouth. You need to report this immediately if you see this. Canker sores. They're not contagious, but they are painful. This may affect a resident's ability to eat comfortably and will be painful to brushing. They last anywhere from 7 to 14 days. Oral lichen planus. Now, don't make fun of me if I'm saying any of this right or wrong, I should say. And cheek biting. Not all lesions in the mouth are cancerous. It is important to notify the charge nurse when any lesions in the mouth is noted during the routine oral care screening. Remember, when in doubt, refer it out. Hairy tongue. I have seen this. The most affect residents who are smokers. Also caused by poor oral hygiene, radiation, or antibiotic therapy. It's important to encourage your residents to brush their tongue in addition to their teeth twice a day. Yeast or thrush can develop from poor oral hygiene, taking antibiotics. When a patient's very sick, I've seen this a lot with patients who are receiving chemotherapy. Dry mouth. Dry mouth increases incidences of dental decay. Sometimes it's medication they're taking. Sometimes they're just prone to dry mouth. Sometimes they're just dehydrated and we need to give them lots of fluid. Roof and floor of the mouth. The most common areas where oral cancer hides is under the tongue or on the sides of the tongue toward the back of the mouth and throat area. You can have the residents stick their tongues out and move side to side to get a good look at the tongue during oral health assessment or when you're brushing their teeth. Have them lift their tongue up so you can look under their tongue. Have them say ah so you can see their throat area. When or if you see anything, make sure you notify the charge nurse immediately. Denture assessment. Ill-fitting dentures can cause sores. Cleanliness, broken sharp edges, missing broken teeth. Fit, is it loose? Resident satisfaction. It's important to leave dentures out during the night to allow the tissue to rest. Also, daily brushing the dentures with a dental brush and denture toothpaste, not regular toothpaste, is imperative to prevent infections. Check to see how the dentures are fitting. They should not be loose. Ask or observe if the resident is able to eat with the dentures. If they are unable to eat, have the resident see the dentist. You need to notify the charge nurse, the RCM, so we can get them into the dentist. We can't not have people eating. Okay, that finishes up the training part 1. And click on training part 2 next. Thanks.